Thank you. First of all, I would like to thank Mr. Mohan and Informate for inviting ProtectHealth Corporation to give a talk on holistic healthcare solution. I am humbled to be here because this prestigious event actually invited a lot of very good speakers and very well-known speakers. So without further ado, I would like to introduce myself. My name is Dr. Mohammad Muhaimin. I'm actually from National Health Financing section under Planning Division of Ministry of Health Malaysia, currently seconded into ProtectHealth Corporation. Later I will explain to you who is ProtectHealth Corporation. Although I have a very quite limited experience in health financing, I'm also the one of the writer for the health white paper, which is tabled in Parliament and accepted by the Parliament last year. So I'm actually both doing the policy making and also the implementation of policies. So next. So this will be my online outline of my presentation, some introduction of ProtectHealth and the holistic healthcare solution, and lastly, the AI in healthcare. So who are we? Who are ProtectHealth Corporation? So ProtectHealth Corporation was established in 2016. It was a government-owned company. We are owned fully by Ministry of Health Malaysia. We are not for-profit agency. We with a very specific social agenda. Our main role is actually as a strategic purchasing, in which I will explain to you what is a strategic purchasing. But our social purpose, we come up with 4 main goals, which is number 1, a leader in introducing payment mechanism, innovative payment mechanism in Malaysia for healthcare. So currently in our market, a lot of healthcare services were paid by fee for service. There are none, or there are minimal organization that allows you to have or using any other payment mechanism, in which WHO and World Bank is already pushing towards a more effective and more better financing mechanism, such as bundle payment or capitation. So in government, we are in government sector, purchasing from outside also have their own rules, in which doesn't allow other payment mechanism to be implemented. Therefore, that is where ProtectHealth comes in. So we can introduce some of payment mechanism, in which I will explain later. So next, we are supposed to implement an equitable, effective, and efficient source of financing or funding to supplement the public funding for healthcare. So again, our vision is to push a value-based healthcare, in which every ringgit, the taxpayer money granted to ProtectHealth to procure health services is well managed, efficiently managed, with good quality to the patient. So that is our social role in Ministry of Health. So the next one is improve and expand accessibility to quality healthcare. So when we talk about effectiveness or efficiency, a good efficiency may have an opportunistic cost of accessibility. So some areas have issues of accessibility, and some areas have better accessibility of healthcare. So as ProtectHealth, we are also playing a role in expanding the accessibility of healthcare towards all Malaysians, regardless of their social economic status. And lastly, we want to create healthy and strong competitive market to any health financing and agency. So we want to work with the market. If I quote back what Datuk Kuljit said previously in the morning, that our healthcare system is dichotomous, whereby public funding often used in public sectors, healthcare, and private funding or OOP or insurance are mostly used in private healthcare settings. There is very minimal to none transverse of this funding from one sector to another sectors. But our role is to make it harmony between public sector and private sector. This will allow a more competitive market for healthcare. So when I talk about strategic purchasing, there is a lot of definition that is available in internet or over everywhere. You can find strategic purchasing. So what I did mean about strategic purchasing is to compare it with passive purchasing, which is usually done in government setting. Passive purchasing is focusing on inputs rather than the quality or the outcomes of the patient. So when they outsource some services to the private sector, they pay fee for service and, to say the least, do not monitor the quality of the services rendered. But in strategic purchasing, we understand the market and we want to ensure that this is what we want and this is the quality what we want and this is what we should get for the money given. So there are 4 levels of strategic financing. Number one is what is the thing or the services that we as a strategic purchaser want to buy. So usually we use the terms of benefit package, whereby we analyze what are the needs of services or healthcare services in the certain areas, or for example, maybe in the whole nation, we need to strategize, we need to stratify every risk factors in every region or every states in Malaysia. Then we will do one benefit package with the specification. What type of care, what level of care, what lab services that we need. These are the what. The whom. Whom means to whom that we are contracting to. Meaning it can be anyone in the market, including government sectors. For example, in our hospital services outsourcing program, we are actually contracting with HPU or Hospital Pengajar University, or in English is teaching hospitals, which are government owned by the Ministry of Higher Education. They are also government sectors, but we can contract with them. So it expands the accessibility of services for hospitals. Next is how much we want to pay and how we pay. The number one is we do analysis on the pricing. So we want to set the price, what we want to pay, and how we pay. The how we pay is the one that defines, it differs from services to services, it differs from objective to objective. I will explain later. And then what is the last levels of strategic financing is the quality. What quality that we want? What is the accountability from the private sectors about the service rendered? These are the things that are very important. Without these 4 levels of strategic purchasing, the concept of strategic purchasing will fail. Okay, so what is value-based healthcare? So value-based healthcare is part of strategic purchasing. You can say that it's another name for strategic purchasing, but we use, in ProtectHealth, we use more towards value-based healthcare. So we've divided the perspective of value-based healthcare into 2 perspectives, the payer and the providers. The payer, we give an alternative to the payer that they can have an incentive, they can have a payment model that incentivizes good quality and cost-effective care. While to the providers are given an opportunity to be incentivized if they are doing things right and with a good quality on top of the patient outcomes. So most of doctors, I believe every doctors in the world, they want to see a patient getting healthier. And they want to do more to that patient. So in fee for service, if they do more, they want to charge more. But if you do it in bundle, they do more also, and also they are getting incentive on top of their performance. Okay? So value-based healthcare have a lot of, there are a lot of payment mechanism in the world. Okay, so we lump it up into certain levels, and then we put it volume versus value. So the higher the value, the more value has health-based healthcare you are introducing. For example, fee for service. Fee for service is one of a payment mechanism in healthcare that is least value-based payment. This is due to what you are paying is the service that you are getting. There is little to minimal quality component into it. So when we go into up to the level of capitation or capitation-based contracting, capitation means you already calculate the risk of the patient in that level of region or in the country. Then you put the money on there, and this incentivize the provider to do better in terms of preventing diseases. So these are the qualities that we want. We don't want to push people treating illnesses, like in what health white paper is saying, from sick care to health care. If you're doing things like capitation, you are actually more towards health care rather than treating the diseases. Okay, one of the payment mechanism that we introduced recently in hospital service outsourcing program is actually bundled payment. Bundled payment is where we bundle the care of a certain procedure. For example, we take a CABG. We bundle from pre-care, pre-assessment care, until the follow-up of the patient doing the CABG. This all bundled package is priced in one price. Therefore, in that package also, we put a specification that this patient can stay in your facilities up to 17 days. We know that most of the time, very simple and straightforward CABG cases, the admission is less than 10 days. But we put it more because we anticipate some complication. But this incentivizes the providers to ensure that the operation done to this patient is very good, that the patient can be discharged early without any complication. So they can save on the days of bed needed for the patient. This is one of example that we did for HSOP. Okay, so this is what I've talked about, the value-based healthcare, where we are focusing on no one is losing, or no one is on the losing end. Okay, everyone wins. The payer wins because it can save them the cost. It can reduce the cost. For the patient gets the quality care they needed and with a good outcome to the patient. To the providers, the providers are incentivized to do better. And when they do better, they get more incentives to do better at the end of the services. Okay, this is what I just mentioned just now. For bundle payment, we actually included the pre-procedure preparation, post-procedure care, and post-procedural follow-up for patient under our HSOP or Hospital Service Outsourcing Program, in which I talk a little bit about the pricing. This pricing was done with a lot of reference that is available at our hands, so that we can put one price to this package that we want. So it's already covers all the components of strategic purchasing. We know what we want, and we know whom we want to contract, and we know what is the price and also how we want to pay them. And lastly, we have quality monitoring, in which we are monitoring at every level of care to the patient at the panel provider side. We know that how many days that patient need to wait for the procedure. We know how many, is there any complication happens to the patient. Even the patient can come to us and complain about the quality of services, in which we are monitoring also. So, moving forward, currently Malaysia doesn't have any per capitation or other financing payment mechanism, innovative payment mechanism, in which we started to introduce the bundle payment. Moving forward, we aspire to do NCD treatment using capitation model, in which a lot of countries, for example, Thailand, our neighboring countries, they do primary health care using capitation, in which these areas or this region or this district, they calculated every risk and they stratified every risk of that patient there towards the disease, and they put it in the terms of cost. And then they pay a little bit more to the private providers that took care of that population, so that they can, that population is healthy. The caveat, the incentive here is the more patient needs healthcare services or acute healthcare services or being diseased or not healthy, the less incentive you get. So if you keep a patient healthier, doing promotive and preventive more, then the patient does not need any acute care, especially in NCD treatment, so that you will get that extra as an income for you and a profit to you. So that's part of our capitation, that we want to focus more of the payment towards the quality of the care. So these are the examples of project that ProtectHealth has been doing. We have a hospital outsourcing, service outsourcing program, in which focus on hospital services. We have Scheme Perubatan Madani. Scheme Perubatan Madani focuses on primary care, acute primary care cases, and PKB40 focuses on detecting and screening for NCDs. We have also a project of ESP SPICPA. We are the internet electronic service provider for SPICPA, and lastly, we are the one also did the SPIC program vaccine for COVID-19 3 years ago. Okay. So these are the competencies that we achieved since 2016. We start very small that time. I think I was not even here. It started around 20%, and then it started growing with better competencies such as medical analytics. We have medical audits in our team, and also the large-scale system in-house development. Every system that we use are developed in-house. Then the competency builds up as the project goes on. Okay, so enough of ProtectHealth explanation. So we are going into the holistic healthcare solution. In a holistic healthcare solution, in my definition, is a womb-to-tomb concept, patient-centered concept. In this is also highlighted in the health white paper, in which we are saying that healthcare is a spectrum from the patient born until the patient died. It should be everything inside in between there. Therefore, we tabulate it into a very simple form, which are promotive, preventive care, primary care, hospital care, and rehabilitative and palliative. Although this is not exhaustive, but this is part of the examples that we have. So if you can see here, it starts from detection and prevention until curative, until rehab. Does everyone need everything? It does not necessarily need everything. But every point of our life, we can encounter, there is a possibility that we can encounter any part of this care Okay, so currently, our project, we already covered the hospital care under HSOP. The primary care, acute care, is the scheme Perubatan Madani, and part of it is PKB40. And promotive and preventive, we put it vaccine and also actually PKB40, in which we do the screening of NCDs. So we aspire that PKB40 will expand into an NCD treatment, thus almost completing all the spectrum of healthcare. Maybe, inshallah, we also aspire to do the long-term care in our aged care. So our aspiration is enabled by an in-house digital platform, which is supported by behavioral insights intervention. We are currently collaborating with Institute Tingkah Laku Kesihatan, IPTK, and we also generate, because we have the B40s mainly data, so we have a very big data to analyze. Hence, we have our analytics teams doing the necessary to build a more robust models and solution for the healthcare solutions. So, holistic healthcare solutions also enabled by AI, and in which we are in this current event is about AI. So these are the AI development life cycles, in which the most important thing, I believe Dr. Kev also mentioned this morning, is the data. So in which they have issues of getting or collecting the data. This is where we see that ProtectHealth has the upper hand, because we have more data and we are closer to KKM. So to be exact, we already did one of machine learning regarding claims module. Currently, our scheme Perubatan Madani will undergo a machine learning to tag and issues of claims related to either from the provider or the patient. And due to our spectrum of services, we actually already have the preventive and the acute and the primary healthcare and also the hospital. Currently, we are also in the midst of developing an exchange in which all this data can be pulled and to get a more comprehensive. It's almost like an EMR, but at a ProtectHealth level. So, for example, we can have a data from PKB40 patient that do a screening. And then this patient also going for scheme Perubatan Madani to have, for example, have a flu of cough or any disease, any acute diseases. And this patient may also goes into our hospital service outsourcing program, in which maybe that patient done CABG this year. So we have all the spectrum. In terms of EMR, we are already ongoing to be there. So going forward, we are currently at the between diagnostic and predictive level of machine learning or AI, in which we are focusing more with our vast majority of the data towards a more predictive and prescriptive level. These are our aspiration as we're moving forward, and we know that this data and AI is the future of our healthcare. So I believe that one day we will be there as a ProtectHealth. So as a conclusion, holistic healthcare solution is the future of our healthcare system, and it is very much achievable. I believe that with a good footing, we can merge all these healthcare solution, either it's primary healthcare, it's secondary or tertiary, or even specialized, subspecialized healthcare. We can merge it together with a single system and a single payment system. And then ProtectHealth, as a strategic purchaser, will play a crucial role in ensuring the implementation of efficient, effective and equitable to all Malaysians. And lastly, ProtectHealth already embarking into machine learning, like I said, and we are constantly developing the models for machine learning. Although the journey is still long, but yes, it is not impossible. So with that, I end my speech. Thank you.